The next bill we have is House File 3445. Representative Hicks. While you're coming to the testified table, I'll move that your bill, House File 3445, be laid over. Please introduce the bill and proceed.
Thank you, Chair and Committee. House File 3445 is a continuous improvement study to really try to figure out where are the gaps and the concerns around accessing disability services. As many of you in this committee are well aware, this is a very complicated process where parts of the process live within the state requirements and state offices, other parts live within counties. Some pieces are reliant on input from medical professionals or others. Oh, thank you. And we know what's supposed to happen, and then we hear over and over again about what is happening. And those two things don't always seem to line up. The goal of this project is to identify and map out what should be happening, what would be the best option, and then listening to people with lived experience to identify what did happen. And to work with an independent contractor to identify where those two things don't align and what kind of policy solutions would help improve that situation for people accessing services, using the lived experiences of people who have had to navigate this system. So rather than talk on at you, I would open it up to my testifiers to share their experiences navigating this system.
Well done. So the first person is Ms. Nelson. Welcome to the committee, and please introduce yourself and proceed.
Good afternoon, Chair Noor and committee members. I'm Jillian Nelson, the Community Resource and Policy Advocate at the Autism Society of Minnesota, and I'm here today to ask for your support for House File 3445. I am also an autistic adult and a participant in Ramsey County Disability Services. I will tell you, on most days, my work here on the Hill is simpler, more streamlined, and effortless when compared to the process of applying for and navigating disability services. I could spend an entire hearing telling you about the unnecessary appeals, the 3-month argument over a request for an accessibility tool that was already an approved waiver goal, or the complicated and time-consuming paperwork process that seems to always result in being told I missed something, even if I do it the exact same way I have done it every single time. Disability Services is the only program in Minnesota that 100% of the participants are people with disabilities. And currently, it is the least accessible program Minnesota offers. Last year, Representative Hicks and I came to you asking for an accessibility task force to look at the challenges of the system. We heard your hesitations and the concerns about the vastness of the work to be done, but we also believe in the necessity of improving the experience that people with disabilities face when working within this system for life-sustaining supports. We knew in our heart of hearts that this work had to be centered on the lived experience of our community and the very massive obstacles faced daily, and not the perceived process that is laid out by administrators. And that is how the Continuous Improvement Project was born. For too long, the disability community has been the one to bear the burden of consequence for lack of accessibility and administrative errors for how the state and county administer disability services. If DHS thinks that Waiver Reimagine and MnChoices 2.0 will solve all the problems and make it more accessible for people, that is a demonstration of why this is necessary. When administrators think of reform, it's about how to make the system work better for them. But what we need is to make this easier for people to navigate the services. The Continuous Improvement Project will tie in the reality of what is happening for people navigating the system compared to what should be happening. When we understand the disconnects are happening, we can repair the problems with more than theory or reimagining, and we can apply real experiences to create real solutions. Thank you for supporting House File 3445.
Thank you so much for your testimony. The next person is Melina Bates. Please introduce yourself for the record and proceed with your testimony.
Chair Noor and committee members, my name is Milena Bates. I had a little mishap with a water bottle, but I can still read it, so.
You got it.
I'm here to speak about House File 3445, which would initiate a process for a continuous improvement study for access to disability services. I know that the need for this is not obvious to most people. I am a parent and support person of children with disabilities. I have provided disability supports in professional roles. I'm a community mentor and organizer, co-founder of Minnesota Autistic Alliance, and I have my own diagnoses that make me a part of the disabled community. I am well-educated, well-read, and speak multiple languages, and still the state and county forms leave me baffled and sometimes crying in frustration. For years, I did not admit this to anyone because I thought it was my own deficit. But then we had a Zoom town hall about accessibility of disability services with hundreds of people in it, and I learned that my experience was the norm rather than the exception. And I've been learning about accessibility in both formal and informal education, and the main point of what I learned is that it's much more than ADA compliance. Basic access needs also include written materials in accessible formats for dyslexic people, using plain language, offering alternative communication methods for autistic people, for example. If there is one place in the community where they should exist, it should be disability services. The current situation where disabled people have to get through an inaccessible process to have some accessibility in their lives is not only absurd, but is causing people to be unable to work and thrive, need ultimately more intensive interventions, and in some cases even lose their lives as a consequence of lack of access to services. I hope that gives you a glimpse of why this initiative is so desperately needed. And thank you for everyone for listening, and thank you to Representative Hicks for your allyship and for caring. She's heard me say this before, but I will say it every time.
Thank you so much for your testimony. The next person is Jonathan Murray. Welcome to the committee. Please introduce yourself for the record and proceed.
I'm Jonathan Murray. Good afternoon, Chair Noor and committee members. I'm a board member and co-chair of the Anti-Racism and Intersectionality Committee over at the Minnesota Consortium of Disabilities. I'm here both as a person with disabilities who is reliant on waiver services to supplement my disability tax, the capacity lost by my disability, and as an expert in designing for disabled communities. And I'm here to support this bill. In the next couple of minutes of testimony, I'm here so we can be uncomfortable together and talk about how HF3445 represents the minimum that you can do to start the process of ending the cycle of you approving money for maladaptive supports that don't fit the disabled people of the state because they were not designed by the disabled people of the state. The mindset of othering peers with disabilities instead of as peers paying extra costs of crib time and disability taxes is intrinsic to how the Minnesota Department of Human Services today is structured. In the meeting I led between the Consortium of Disabilities and DSD about CFSS and MN choices, I met fantastic DHS staff that believe passionately in what they are doing and poured that passion into CFFS and MN Choices 2.0 rollouts. They believe they are doing good work, and they are working hard. Unfortunately, they're building things that don't fit because they aren't working with the disabled people they serve. In many ways, they're literally prevented from doing so by systems and structure that are in place that reinforce the mindsets they have. They know best, and that echo chamber that is DHS helps prevent them from getting curious getting humble, and going out and listening to the people they are serving and working with them. During that meeting, I learned that the assessment is built around the case managers and the assessors, being the end users, not the disabled people. That they are not collecting any feedback from the disabled people about the rollout process, and that having equal access to your records is not intrinsic to the build, like it is in the rest of healthcare. Staff was not aware of experiences of myself and others that basic cultural awareness on disability is not being trained for the assessors at Ramsey County. And that I have had to do that training myself on what it represents to have less capacity, and so that they had the awareness to do that assessment for me. This is the story of one project. Think how much could have changed if instead it was a story of how disabled people building with other disabled people, amplified by the support of everyone else at DHS, this project could have turned out to be. To share the vision of what is possible, I'd encourage y'all to watch Crip Camp tomorrow if you haven't, at Disability, and to connect with those at Disability Day at the Capitol to dream how we can catch up here. And please support this bill so that you have a report on what is going wrong. Thank you.
Thank you so much, and thank you for sharing your story. Appreciate it. So the next person is Jules Edwards. Welcome to the committee. Please introduce yourself and proceed.
Bonjour. Jules Edwards, Nindigenous, Jaganashimang, Magazine Nindudam, O Negamasing Nindunjaba. What I just said was an Ojibwe introduction. My name is Jules Edwards. I'm Eagle Clan and I'm from Duluth. I live here in the cities now, and I'm here to support House File 3445. So you'll hear some of the core reasons for this bill from other people, and I want to focus on the desperate need for this within the Indigenous community. I went to school for accounting, and life happened, so now I work as an advocate for Native children and families and disabled people. I was appointed by the Minnesota Indian Affairs Council as a board member for the Minnesota Ombudsman for American Indian Families. I am the tribal liaison for Gillette Children's Specialty Care, and I am a co-founder of the Minnesota Autistic Alliance. In Minnesota, Native people have the highest rate of disability of any other race. And this is data that was collected by the state. Yet we have the least representation and the least access to disability services. Within Ojibwe culture, disability simultaneously does not exist, and it's a natural part of life at the same time, because everyone needs help sometimes. Many of us don't know we have disabilities. Most of us don't know what disability services even exist, much less how to access those services. So beginning in childhood, Native children's most often introduction to DHS is child protection, and it's not because Native parents are bad parents. It's because we live in a settler society that actively oppresses us. Minnesota has the highest rate of out-of-home placement of Native children in the country. There are counties in Minnesota in which 50% of Native children are in foster care. Approximately 40% of children in foster care have a disability. When Native parents reach out for help, they are often denied help, and instead their children are taken away. I have personally supported parents whose children have been stolen because they asked for help for their children, but they didn't know the action steps. I once asked Patina Park if she knew any Native children who used a certain disability support, and she said children who need that form of support are more likely to be in foster care than to have that support. Those who do know the DHS pathway to ask for disability services for their children are offered a 65-page form to fill out before they can even speak to a social worker. I come from an oral culture, and these paperwork barriers are just one small instance of white supremacy within disability services. In adulthood, disabled people who do not have the support they need often end up unhoused or unstable in many other ways. When I see encampments being raised in Minnesota, I think of my disabled relatives who had so little and end up with less. And I feel so angry and helpless. Often, all they need is waivered services in order to be able to live self-determined lives within the community, to be able to have housing stabilization, to be able to have food that doesn't make them sick, to have a safe place to be where they don't lose their limbs because of diabetes. Because that happens to us. It's happened in my family, and I am at risk as well because I'm diabetic. When I applied for disability services for my family members, I had to negotiate a reasonable modification with the state for the county to follow in order to access services. And it took over a year, and it took countless Google searches because I had to figure out how to ask for accommodations independently, because when I asked the county, they wouldn't tell me. They didn't tell me who to call, they didn't tell me who to email, they wouldn't have spoken to me until I filled out the 65-page paperwork. What happens to the people who can't fill out 65 pages by themselves? They end up in the encampments. That's where my relatives are. So I also have 2 adult children. One is 20 and one is 18. Both have disabilities. Neither one of them would be capable of filling out those forms. Neither one of them would have services right now if I wasn't there to help them. Both of them would probably be unhoused or sleeping on a friend's couch, except one of them doesn't have that kind of support network. People are dying. Native people especially are dying because we don't have disability services. We don't have access. We don't know about it. We can't have the one-on-one support that we need in order to fill out the forms, to answer the questions. Many of us don't have an address. How do you communicate with the state or with the county when you don't have an address? You're supposed to get on a bus or whatever else and get to the county building to do the pickup at the county. Who's paying for the bus? We desperately, desperately need this study. We need this information. We need the data. I am tired of being statistically insignificant because that is what I am on all of these studies. And this specifically talks about Indigenous people. When we're talked about so little within disability services. And I'm probably over my 2 minutes and I don't care. Thank you so much, Miigwech. Please support this file.
Thank you for your testimony. Any member discussions? Representative Kwok.
Thank you, Mr. Chair. And I see the phrase continuous improvement in here. Why isn't this an analysis of the issues, the problems, and looking at what works in other states, what works in some counties, what are the options that seem to work in different situations? That kind of a study, I think, would actually be useful. Continuous improvement in all the different companies, entities, and areas that I've come across it is a different type of analysis. It sounds as if digging down and looking at problems and issues are are something that this should focus on. And if there are specific issues on reservations, then there should be a look to address that, because there are some, whether it's open or closed, there are some differences in the interactions with the counties internally. So we should have a partnership built between the counties, the tribes, and the different entities that are interacting. I like some of the content of groups involved. I'd really love to have parents and family members who have been in the process helping and seeing what's going on, because their input could very likely bring a broader perspective sometimes when you're in the situation, you maybe don't pick up on some of the things going on, but caring family members might have some really good input. I have talked on other bills of why don't we have the technology and utilize it for the voice interaction, so you don't have to do typing, you don't have to generate a page and fax it. The utilization of technology has been out there in different locations, and let's plagiarize as much as we can, because there are tools that are being utilized in other areas that would allow for a conversational interaction to do these forms, and so that it would work for a broader spectrum of people. I know there are a lot of developments for language interaction with these type of applications. So look at the states and what they've done and take the best options and pull them in and then utilize them in possibly some pilot projects. I'm just thinking we could be more effective with a slightly different twist to this, because I'm sure there are some states, some counties, where the individuals said, here, let's do this because it will work and help the people. I don't think we do enough cross-pollination because government likes this is the way we do it. But because we're talking about individuals from different communities, we need to have the idea of here is a menu of options that we can select that will actually help people instead of just frustrate them. So I'm very open to working with the author and maybe improving this. I just think it needs a little bit more built into it. Thank you, Mr. Chair.
Thank you so much. I'm hearing that Representative Quam will continue to work with the continuous improvement of the bill on the continuous improvement. Maybe that's the correct term. I have Representative Lesnick.
Mr. Chair,
Representative
offline we can cover that.
All right, Representative Quam, Representative Zelesnica.
Thank you, Chair, and thank you, Representative Hicks. You and I have had conversations on forms within the system of serving people, and I understand what that looks like. That's been my world for 40 years, from being a nursing assistant to a nursing home administrator, and served people of disability my entire career. And I think the thing that is so monumental is the overwhelmingness of all the paper. It's just 65 pages everywhere you turn, whether it's children, disabilities, every scenario, and it goes on and on. So, you know, I think these barriers are real. I know they've existed because I've had years of families in my office, and I've also had many people who had no family. And there is nobody. They had no children, or they have many reasons why that there's nobody to help them. And to fill out these forms, there are people that are hard of hearing. I've had people that are blind. I have people with cognitive impairment. All these lists, it doesn't know a race. It doesn't know a gender. It doesn't know an age. It is a real limitation, and that's why my concern has been this is a very important need, and this improvement study is something I support. I just am really concerned that we don't have the SSIS system, which I've shared with many times in multiple committees we're all on, to get this doggone thing fixed, because the fact is people are submitting and faxing and driving records, and they get lost, and there's copy and paste, and there's just, it's a very archaic system that deals with the application process for medical assistance and helping people with disability. And there's 87 counties. And then the tribal nations, and it just is so archaic. And so I appreciate your initiatives to, do a study and do this. My only question is if it's the right time. We have a infrastructure issue and we have an access issue, but I 100% support streamlining and making this user-friendly for people, because I have been frustrated with this my entire career. So thank you very much.
Representative Hicks.
Thank you. I'll respond to those too. I know there's other questions, but I sort of want to reground in that some of you may not know this about me, but I'm actually Greenbelt certified, which is like just a tiny little step on the continuous improvement certification. But part of what true continuous improvement does is it looks at what do we think is supposed to happen? And then it looks at, in this case, the lived experiences of various people throughout the state, family members included, right? What actually happened and where is their disconnect? Because part of what is so frustrating in the disability services space is, like you said, representatives, both of you, we have 87 counties. And so there's what's supposed to happen and then there's what is happening. And whether what is happening is better or worse is a judgment call. All this is saying is let's identify what we should be seeing, right? What are the timelines supposed to be? What is the process supposed to be? When can you deviate from it? When is this first or that first? When are they interchangeable, right? What is that supposed to look like? And that's not going to be that hard. That part's pretty standard. A lot of it's already written out in policy and statute and rule, right? Where, in my opinion, this study does something different than what we've ever done before, is it then journey maps with people who tried to navigate that system and says, how did their journey look different? Where was there an additional form that isn't in statute and rule that some of the testifiers talked about that's being used? Where was this supposed to happen, but instead this happened? Where was there supposed to be an opportunity for accessibility and accommodations and class standards to be followed so that people could access the form, and when didn't that happen, right? So we can identify what's supposed to happen, what is happening, and where we as lawmakers can make changes to fix those places that are of concern. We don't even know where those places are. Just in the comments we heard from testifiers, myself, and just the couple of members who have spoken yet today, we have identified a half a dozen different potential places. And before we can really say this process works or this process doesn't work or this thing is working or this thing isn't working, we need to look at what's supposed to happen, what is happening based on what people are telling us. Because there's a huge disconnect based on our testifiers today between those two things. And until we identify where those different breakdowns are happening, we're going to keep spending a lot of money with a lot of innovative ideas, throwing spaghetti at a wall. And I do not think that that is the best use of legislative time and efforts. Because if we revamp SISS and MMIS and Maxis, and we haven't had the input as to where we need to fix the process from the people who are experiencing the process, we're going to have a whole new system. It's going to be really fancy. But if it doesn't fix the problems of what's happening to people as they try to access systems, we're going to have a really fancy system that doesn't work.
Lee Newbernley.
Thank you, Mr. Chair, and thank you, Representative Zalesnikar. I was like, wait, Representative Hicks is agreeing with Representative Zalesnikar, right? Yes, okay.
About IT, always.
Well, and I would just add, Mr. Murray and I had a conversation about this following committee recently, and frankly, Commissioner Harpstead testified before committee last year, and I don't remember what the issue was, but I asked this precise question. What is your interaction with an end user? What input are you getting from an end user? And they told me nothing. They said literally they had not connected with anyone who would be an end user. So really, really important. My question is actually just on the fiscal note. Do we know what is happening? It said it was posted, but then it said it's being revised.
Mr. Burke.
Madam Chair, Representative New Brimley, that's the extent of my knowledge is it's being revised, and I don't know what the issue is. Probably that's something minor, but I don't know.
Lee Newbernley, I think there was recommended changes, which we will have to bring it when we are, rehearing our bills.
Thank you, Mr. Chair. So meaning there might be an amendment coming that would revise that fiscal note as well?
Representative Hicks, anytime we have, I think, an amendment, it changes the numbers based
certainly
on
should,
what we
yes.
do. Go ahead.
Yes, I have an amendment. I didn't quite get it done in deadline. I don't know if you've noticed. It's been a busy week. There was a lot of snow. But the goal of it really is to make sure that we are tapping into all of our communities. I do not anticipate it affecting the fiscal in any way.
Thank you, Mr. Chair. I would just remind the committee that there isn't very much money, and I do hope we're being very careful, because anything we do now is adding to the deficit later. So let's be very cautious about how we move forward.
Any further discussion from members? Your closing remarks, Representative Hicks.
I just want to thank everybody for being willing to hear this bill. I think a lot of times as legislators, we can very much be in a problem-solving space, and that is a great space to be in. But it's not an effective space if we aren't really clear on all of the problems. And so my goal is, before we dive in and spend a whole lot of money to fix a whole lot of problems, that we really identify where the problems are based on the lived experiences of people who have encountered those problems.
With that, I'll renew your motion that House File 3445 be laid over, so the bill is laid over.